today with a new topic, and it will be very interesting for all of you. No? So it is on international health. Okay, please everybody put your attention to the slides. Okay, all subjects are equally important. In fact, this subject is very important. It will be throughout your life. Okay, so this is international health, the definition and concept. This is your competency 18.1. As per this, we need to discuss and define the concept of international health. So what is international? What is international and what is global? Do you know? So we have international boundary with India, Bangladesh. Which are other countries bordering with India? Which are other countries? China, Nepal, Bangladesh, Bhutan, yeah. So Myanmar, no? So it is about a border, international border means this side and that side of two nations. International, international means inter-district, interstate, no? Intracellular, intercellular. That type means between countries. Okay. So, what is this health? International health. Can you tell us? Like COVID-19 was a national health or it was an international health or global health? International, in fact, it was a global health. It was a pandemic. It affected all countries. Why international health is important? Why international health is important? Why? Why international health is important? Because the health of one country affects the other countries, especially infectious diseases. If there is an outbreak of cholera in Bangladesh, no, it can easily come to India in the bordering areas or even more inside, no? So due to travel and trade, the diseases are getting transmitted from one country to another, isn't it? That is why the infectious disease of one country affects the other countries, and that is the concern. So in the following slides, we know how the concept of international health came. So in this slide, we will be learning what is the international health, the evolution and concept of international health, how it is different from global health, and describe key component and focuses area of international health, and what is its relevance to India. This is very important because if you want to travel to US, you need some documents to prove that you are healthy. You need immunization certificate. Now, if you are traveling to other African countries, you need to prove some documents that you are vaccinated. Okay. So people traveling to Hajj, they need to produce a polio vaccination certificate to the government. Otherwise, they are not allowed to enter. You know, because those countries, they are immune to polio viruses. So they do not want to compromise their health situation by inviting the people from other polio infected countries. That is why they want certifications. No? So as a medical student, you may be asked by your parents, by your fellow students, no? Why this certificate? Why it is needed? If you want to travel to US, no? Your parents will be running here and there to gather a immunization certificate. We as a doctor, we always face this problem in our chamber, in our clinic, in our hospital. Because in earlier days, those documents were lost. So why these requirements came? Because of international health. No? So, am I loud enough for each one of you? Can you hear it? Okay. So, so what is the definition of international health? As per your book, health work or issue that transcend national boundaries and involve cooperation between the countries. This is international health. Means there are some health issues which can be dealt with the cooperation of the bordering countries. Look, it has several elements like cross-border health issues. Cross-border health issues means in Assam it is bordering with Bhutan. So in that border area there is a problem of malaria, isn't it? So malaria can transmit it from each country to other country and other country to another country. So that is a cross-border health issues. Infectious disease and epidemics, you know already there is a pandemic already happened. In earlier days also there were several diseases which were transmitted across borders. And international health involves WHO and other NGOs. Okay, you know WHO, what is the full form of WHO? World Health Organization. It is the authority in the health. It gives the statutory guidelines for adoption by each the member countries, and each member countries adopt the guidelines with some modifications. Okay, so WHO, can you name any other international health organization? Can you name any other international health organization? Can you name? Like one is WHO. What are other international health organization? NGOs. NGOs are here only. Nagaland, Manipur, Mizoram, Tripura, they are all NGOs. They are not international. What other international organizations, health organizations? Can you name one international health organization? What? IUCA? IUCN. Can you name one international health organization? One is WHO. What is the other one? They work for health. UNESCO. That is a cultural and scientific body. Similar to UNESCO, another one is they work for children and women. UNICEF. One is UNICEF. These are international health means, no? UNDP, United Nations Development Program. And what is other? When there is a war breakout, who goes there? In case of war, who goes there? Red Cross scene. Red Plus scene is for doctor or for some other organization. Red Plus scene. Red Cross Society. International Red Cross Society. No? There are several such organizations. These are international. They have no boundary. They can go anywhere. Okay. So, these are the international organizations. So, how does the concept of international health come up? Hello, madam. Yeah. So, it is also important because it will come in your exam. It will not be repeated. Okay. At least you should remember WHO, UNICEF, UNDP. These are the organizations. They work internationally for improvement in health. No? So, during COVID vaccination, you have been listening to these organizations very frequently. Like the textbook says, nothing on this earth is more international than disease. No? So disease is the most international thing we have. But other international thing also we have, like branded of clothes, shoes, specs. No, due to globalization, all things are becoming global. But the globalization is a later thing. But before that, the disease came first as an international thing. So nothing in this world is more international than the disease. It spreads very frequently and very rapidly. Like COVID-19, it originates in somewhere in a place in China, and over a period of months, it like cover up the entire world. No business can spread so fast in a span of 1 month or 2 months, isn't it? So it is very difficult. For a business, you need an organization to spread. But for a disease, they do not need any organization, isn't it? If you are a businessman, if you want to spend your business, you need many people, HR money, but it is free. Disease spread freely. No organization, no leadership is required. They cross anywhere. There is no passport, no visa is required. They just come with you. Okay. So there are these transmissions are happening due to travel and trade. People are traveling every day, international travels. Every day people are going everywhere, coming back. Indian going out, other coming in. So because of this travel, the diseases are transmitted from one country to another. In earlier days, there were plagues and cholera. Plagues and cholera. Now those things are not there. Cholera is very less now, and plague is not seen. So these two diseases also spread through trade route. Next, quarantine. You know what is quarantine? During COVID time, no, there was it was very frequently used term, no, quarantine. What is quarantine? What is quarantine? What is quarantine? It tell us. Because no, these are already you have heard this term. What is quarantine mean? Quarantine. He has been quarantined. One person coming from Bangladesh in the airport and he has been quarantined for 14 days. What is that? One is isolation and one is quarantine. Isolation is thus for a diseased person. Okay. For a infectious disease, if we confirm that he has the disease, he is isolated, like in COVID-19. But quarantine is done for cases where you suspect him, okay, that he might have disease. That in these cases, the person is quarantined, means he is kept some isolated area away from other people. So this is quarantine, the restriction of movement of suspected person of a disease from other person. Okay. So if someone of you become ill, sick and having runny nose, then if yourself keep close in a room and not mixing with other people, so you are quarantined by yourself. No, you are not mingling with other people. And when your disease is diagnosed and the medical authority isolated you, that is isolation. Okay. So it is a very old age practice of and practice in Europe. Okay. So in earlier time, the 10 days was the standard time for quarantine. Okay. So now there are many, these are historical development, and it was reviewed and followed by many countries, like limitation of early quarantine. Quarantine also had some limitation because that was not practiced by some countries, and later on it became again scientific. Then there were several international conferences. Conferences are places where scientific presentations are made, and you can learn many things from those conferences. Okay.